This is a demonstration of how to perform trach care on a patient. I will begin by gathering my supplies, a trach care kit, non-sterile drape, a bottle of peroxide, and a bottle of normal saline. My yellow gown, my personal protective equipment to protect myself from my patient's secretions. I have a mask with a face shield, but for demonstration purposes so that you can hear me, I will put it to the side. You do not need to have an order to perform trach care. It is nursing care. You will go by your hospital policy. It's normally once a shift and PRN. I will wash my hands, introduce myself to the patient, and with the patient's chart, I am going to check their identification bracelet, noting their name, their birth date, and medical record number. I want to explain to my patient what I'm going to be doing, that I'm going to be cleaning around his trach. I begin also by doing a full respiratory assessment on my patient before I do the trach care. That includes checking their respiratory rate, which I will check on my monitor. My patient has a pulse oximeter, continuous pulse oximeter. This is the probe on their finger, and I have a reading on my monitor. I also want to listen to his lungs. My patient's lungs are clear, and his respiratory assessment, he is stable. If my patient was coughing at this point or lungs were not clear, I would want to perform trach suctioning before I did trach care. I want to put the bed at a level that is comfortable working height for myself and put his side rail down. I have a non-sterile drape that I will drape across my patient to protect his gown. I will begin by opening my trach care kit. I will remove my gloves and put them to the side and set up my sterile field. I will begin by taking my sterile drape, lifting it in front of me, Next, I want to put all of my supplies on my sterile field. Careful not to reach over my sterile field or touch the inside container. My container has 3 compartments. One of the compartments will contain a half-strength peroxide, meaning that it will be half peroxide and half normal saline. My other 2 will contain normal saline. I'm going to check the expiration date, and I will pour about a ½ inch. Next, I will pour my normal saline. Once my normal saline is opened, I need to time, date, and initial it. It's good for 24 hours. I will put a ½ inch of normal saline in with my peroxide. I'm going to remove the inner cannula of my trach and place in the compartment that has the half-strength hydrogen peroxide. Now I will remove my inner cannula. I'm going to move my trach collar to the side. This is the inner cannula. I will remove it by turning in a counterclockwise motion. Pulling it out to the side at an angle. And I will replace my oxygen source. I will now put my inner cannula in my compartment with my half-strength peroxide and drop it. I will put on my sterile gloves. to separate out all my supplies. I will begin by cleaning the inner cannula, the lumen of the inner cannula, with a brush. I will pick up the inner cannula by the outer part. And put the brush through it to clean all of the secretions out of the inside lumen. I will then take the brush and clean the outside. Making sure that all the secretions are completely gone. I will dispose of my brush. I now will place the inner cannula in the normal saline to rinse the peroxide off of it. And I will dry it with a sterile 4x4 and pipe cleaners. The pipe cleaners will go in the inside lumen to really dry it. I will now replace my inner cannula. At 9 o'clock, I will put my inner cannula in, inserting it to 6 o'clock. I'm going to turn in a clockwise motion until I hear a click and I know that it's secured. Now I will remove my drain sponge. I would be able to do this as well at the beginning of the procedure. I'm going to take my sterile cotton tip applicators, dipping them in the normal saline. I want to start at the inside and move out, starting at the inside of the stoma and moving out. And cleaning the plate as well. And just pat dry. As I'm doing this, I want to make sure that my patient is comfortable and oxygenating well. Second to last thing that I'm going to do are change the ties. I'm going to take the end of one of my ties and insert it through the hole on the side here. I'm leaving the old ties on until my new ties are secure. I'll take them and tuck them behind their neck. And then thread the other piece through the other side. I want to tie a double knot away from the area of the carotid artery, either close to the front or at the level of the ear. I should be able to fit 1 to 2 fingers under the ties. I will remove my old ties. The last thing that I'm going to do is put the drain sponge around the tray, and I will tuck it under the plate gently. And I will replace my oxygen source. It's necessary for me to do a full respiratory assessment once I am finished doing trach care. Remove my drape, put my side rail back, and put my bed in its lowest position. Dispose of my supplies, remove my gloves and my personal protective equipment, and wash my hands.